I want to take you now to about how Centre is junking Karnataka Chief Minister's anti-vaccine fear-mongering. Now here's what has happened. Remember that amid concerns, especially because in Hassan district in Karnataka, there had been a series of incidents of heart attacks that had led to death. AIM study has now debunked that there is a link of the COVID jab, the COVID vaccines that we had taken to the heart attack and the link claim that had come in. Siddaramaiah had basically alleged if there is a spike in the heart attack related deaths because of the COVID vaccinations that have been administered to people across the country. And there's been a conspiracy. Remember, you'll hear these conspiracy theorists come forth and allege that, but there's no scientific data that has backed this yet. Now, the government of the centre has said no COVID vaccine heart attack link, that there is no connection that because you took a COVID vaccine, that it has led to heart attacks or cardiac arrests and have led to death as well. This, remember, is being seen as fear-mongering right now, but it becomes more concerning because it's, after all, from the Chief Minister of a state that this link had come in. I want to bring in my colleague Sneha Mordani, closely tracks the health fraternity. Sneha, tell me more about what the centre has said. How are they quoting the same study?
Pooja, the fact is that this is not the first time that the centre has debunked claims made in the past that the COVID vaccine has got a link to the heart attacks that we're seeing in India in the younger population between the ages of 18 to 40. So two things. First, the Chief Minister's statement yesterday, to which we did ask these questions of the government if there would be a clarification, because this is misinformation at the end of the day. If science has suggested that there is nothing, there is no link to the vaccine. And that's the reason why two studies that the government of India is focusing upon, talking about the fact that the ICMR, which is the Indian Council of Medical Research, and the NCDC, which is the disease control body in India, essentially they have been working together. One study conducted by the Institute of Epidemiology, and it has spoken about how the study was done between the ages of 18 to 45 and indicated in 47 hospitals, 19 states, individuals who died suddenly were studied, and it was seen that there was no link to COVID-19. It does not increase the risk of unexplained sudden death. The second study being done by AIMS is also pointing towards that direction. The results are, of course, awaited is what the government has said. Importantly, the government has said that these statements are false and misleading and are not supported by scientific consensus, something that doctors on our channel have been talking about ever since we've been continuously reporting on several cases, including the ones in Hassan that have been seen. Also, I'd like to say two things that the government has stressed upon, that there seems to be no change to the pattern even after COVID. Two reasons: underlying healthcare conditions, genetic predisposition, and risky lifestyle choices are actually playing a role in these unexplained deaths. Nothing else, nothing more, nothing less.
Sneha, thank you very much for now. So at least the centre appears to have put it to rest, but will the conspiracy theories come forth again with these claims?